Craniopharyngioma, as the name implies, it has to do something with the cranium and the pharynx. So there is some extension between cranium and the pharynx. That is what we call as craniopharyngeal canal. That is the developmental part. As we know, the pituitary has got three parts: anterior pituitary and the middle part and the posterior one. And we know the anterior part, it arises from the pharynx, nasopharynx, as something called as rat case pouch. And this thing is called craniopharyngeal canal. So it was this tumor, as it takes origin from the rat case pouch. That's why it is called craniopharyngioma. The thing is that, as we know, the anterior pituitary as well as posterior pituitary, it lies inside the sella. But most of the craniopharyngiomas, they are supracellular mass. It has got varied presentation. It can be there in children and in adults. So that is, it has got bimodal presentation. In children, most of times it is cystic in consistency, but a little part of the solid, a little of it has got solid component also. It is called as machinery oil because when we see the content of that cystic cavity, it contains some oily fluid which has got protein, blood components and cholesterol. So that's why it is called as machinery oil, because of its oil-like consistency. And one thing is very important here, that we see calcification even there. That is important to differentiate it from other conditions. So if we want to differentiate it from a rat case cyst, if it is just cyst, it will have only cyst part. There will be no solid component, there will be no calcification. So that is how we differentiate rat case cyst from a craniopharyngioma. When we see histopathologically in children age group, that is 5 to 15 years of age, what we see is there will be a peripheral palisading pattern that is similar to the enamel of the teeth. That's why it is called as adamantimatous type, which is seen in children. So children, we see adamantimatous type. And also we see something called as wet keratin. So as we know, keratin is something pinkish material. So why it is wet keratin? As we see on histopathologically, it looks like it is suspended in some kind of liquid. It's in the liquid form. So that's why it is called as wet keratin. And another age group we have got is 50 to 75 year of age group. So what is the difference? In that age group, histopathologically, it consists of papillary pattern. And as we talk about Ross pattern, like cystic plus solid, but if it is in older age group, that is 50 to 75 year of age group, there we only see solid component. We don't see any kind of cystic component. So that will be fully solid in old age group.